doctors. Doctors are very busy, and it's more and more patients are going to be needing care. I think the advantage of this is that we're going to be able to do what's called a virtual house call. So instead of coming into the emergency room or coming to a doctor's office, you'll be able to have equipment. Say you're a diabetic, you check your glucose every day or every time you need a shot. Instead of having to go to the doctor's office, you simply log on. You'll be able to send all of the results from your test equipment at home to his office. His nurse reviews it. You'll get on and speak with the doctor. You say, well, you need to increase your insulin dose. So now you don't have to get in your car, drive in, see the doctor, be treated. You know, you can be in Hawaii, you can be in Sacramento, you can be anywhere, and your doctor can personally take care of you face to face and talk to you.
Is that amazing or not? You know, I want my audience, we have a huge audience. We are talking about telemedicine. Maybe what we ought to do, Dr. Birkenbeil and Dr. Dorian, maybe we ought to do a demonstration. How can a patient, I don't understand it, because when you talk about generations, I am from the past generation, and I'm not even close to your generation, and your child, your son, forget it, we're not there. But what's interesting, that is the public going to buy this concept? Are they going to say, it is okay for me? Would you demonstrate to our audience, when we talk about telemedicine and what you spoke about, Dr. Birkenbeil and Dr. Dorian, about the patient being able to log on and not come to the office, and for you to diagnose what has to be done? Can we do that?
Sure. Let me just set the stage. What we've set up right now at Verdugo Hills is for the flu. We know with this epidemic with regards to the swine flu, everybody was concerned. Everybody wanted Tamiflu. How was I going to get the prescription? Did I need to go into the emergency department? I couldn't see my doctor. So what we established at
Verdugo
Verdugo
Hills, talking about H1N1.
Right.
H1N1.
And basically, we've been working on telemedicine, but this set the stage for what we did. And the federal government was said to hospitals, you must prepare a way to deal with catastrophe, where everybody in the world gets the flu, everybody's sick. You don't want patients coming in, mixing with other patients that are not having the flu to spread it. And they talked about such things as setting up clinics in the parking lot of a hospital, so people could drive through and not have to expose people.
Let me do a quick reintroduction. Once again, for those of you that tuned in a little late, we are talking about a concept, we're talking about something that is totally new to me. I don't understand it, but Dr. Birkenbeil and Dr. Dorian do. My guest this evening, the Chief of Staff of the Verdugo Hills Hospital, Dr. Birkenbeil, Leo Birkenbeil, and Dr. Armand Dorian. There's just so much about Dr. Armand Dorian, about the things that they do in the hospital and all this. So we are talking about something called telemedicine. I'm going to have Dr. Dorian and Dr. Birkenbeil demonstrate what does telemedicine, what does it do, and where are we going with this? What is the next step in that? We may take a little longer for the engineers. We may take a little longer in this segment, because I think we're getting to our first, or maybe we ought to do something else. Let me take my first break a little bit early, and then once we come back from our break, then we'll have 2 or 3 minutes at the other end, so we can, instead of taking a break right in the middle of the conversation. We will take our first break. When we come back, more of Dr. Leo Birkenbeil and Dr. Armand Dorian. We are going to talk about what telemedicine means, and we will demonstrate to you how the doctors talk to their patients from home to their offices. We'll be right back. Welcome again. Thank you very much for being with us. Just before we took our break, we were talking to Dr. Leo Birkenbeil and Dr. Armand Dorian to demonstrate what telemedicine means. And so rather than do a lot of talking, let's jump right into the telemedicine. Let me go to, I think we have a patient that Dr. Dorian and Dr. Birkenbeil are going to demonstrate to you how do they communicate with a patient. Hello? Yes, you're on the air. Okay. Dr. Dorian.
So when you log on to vhh.org, vhhospital.org, we have a patient. This is Celine. Hi, Celine.
Hi, Dr. Dorian.
Okay, I'm going to look through what you've said. It looks like you're complaining of...
Celine has filled out some information when she logged onto our website. She got on the computer, accessed the Verdugo Hills Hospital website, and there's questions about the flu, which we're dealing with, that she would have answered about her illness before she even spoke with Dr. Dorian.
So she has done her homework.
She has done
everything.
She's put her information in there.
So Dr. Dorian, you are talking to a patient where she has told you what her problems are.
Exactly. I can talk to her live right now, and I also see that she's indicated, Celine, you have a fever, and it's at 102. Is that correct?
Yes, that is.
And you have a sore throat, but you don't have any diarrhea or vomiting, and you have a dry cough, correct?
Yes, correct.
And it's been for 2 days. So now what we're going to do is a basic physical examination online. What I want you to do is basically, if you can approach the camera, I want to take a look at your eyes.
Wow, pretty eyes.
Yeah,
Yes.
pretty eyes. And they look like normal, non-sunken eyes. And I'm basically doing an exam. She appears healthy. Can you open your mouth and just stick out your tongue for me? Okay, you can see the nice shine on her tongue, so she's not dehydrated. It's moist. Are you having any difficulty breathing?
No.
Okay. And can you do me a favor? Can you bring your finger out in front of the camera like this? Good. Squeeze with your finger, and now release and show me your finger. Good. Okay, your skin is basically dry, and what we're seeing there is the blood fills back into the finger within 2 seconds, means she's hydrated well. Okay, these are all kind of telltale signs or exam signs that we would look in the hospital. Now, judging from her complaints and her exam findings, I actually think she does have a viral illness, okay? And we're using evidence-based medicine. This is the same criteria we would use if you were inside the hospital. And what I do is basically give her an impression, and she has already filled out her email address, correct?
Yes, that is correct.
Okay, so Celine, what I think you have is actually the flu. I don't think you need to come into the hospital, but what I'm going to do is I'm going to give you some instructions. I want you to hydrate yourself, drink lots of fluids. I want you to call your doctor to follow up with him or her, but what I'm going to do is I'm going to write you a prescription for Tamiflu. Because we're getting this early enough, I think it's going to make a difference. And so what I do is I add a prescription, the standard dose of Tamiflu, and then I have the standard aftercare instructions here. And so right now, we're going to end this session, and what's going to happen, Celine, is you're going to get in your email box discharge instructions as well as a prescription. You can take that prescription and fill it anywhere, any pharmacy, and I want you to start that medication and definitely follow up with your doctor in a couple days.
Celine, this is Larry Zarian. Let me ask you, did your conversation with Dr. Dorian and Dr. Birkenbile, does it make you feel pretty satisfied that what Dr. Dorian saw in you and those are the symptoms that you have?
Yes, I'm very satisfied, and the fact that he did diagnose a viral condition, it definitely helps getting the treatment via telemedicine as opposed to going to the ER or the doctor's office and waiting to be seen and so forth. So it's an expedited process.
And you can do that from your home and your office, or your office, anywhere.
Exactly, anywhere. As long as you have your web camera, your internet connection, and a telephone line, you can do it from anywhere.
Amazing, amazing. Well, I hope you feel better. I hope the medication that Dr. Dorian prescribed gets you back with your more shiny, and then even your tongue will be even more red and everything else. And wish you good luck, Celine.
Thank you.
Thank you very much.
Take care,
Thank
Celine.
you. This is amazing, where you can. Let's talk about something else. Now, if Celine were to come to your offices and do the same thing, what would the cost be versus what it is doing this on?
Well, let's take the emergency room. That would have been, this is going to stun you, so I don't want to scare you, about $800.
Wow.
Maybe less. I mean, it could be $400 basically on what kind of tests may or may not done. But basically, she doesn't need any tests. I mean, there was no test. We don't do tests for the flu right now because everybody was consumed to have the H1N1, as you're aware.
And also consider $400 is the bill, but what about the wasted time? Time sometimes is even more valuable to
Drive
you.
to your office,
The drive,
wait.
Yeah, right.
the wait, and time off of work. All of these are lost revenue, not only for the patient, for the company, basically for the society. And then putting that car off the road. It's also green technology. We're not allowing or decreasing the smog. We're decreasing the traffic. We're also decreasing other people getting sick from you by you coming and waiting in that emergency department.
So let's take the lower amount, $400.
Right.
What will this cost her?
This is $100.
Wow. So with all of the other benefits, the cost is 1/4.
Right.
I'd take that anytime. Is this amazing or not? Where medicine is done on the computer, you can do it from home, you can do it from your office. The doctor can diagnose Is this something that's done only at Verdugo Hills? Are you at the forefront of this whole technology?